Hi, I'm Dr. Robert Truth. Today we're going to do buttock implants with solid, soft silicone implants. These implants are specially shaped. There are different sizes of implants. There's round shapes, there's oblong shapes. We try to fit the implants to the person. In this particular patient, it would appear that we need to increase volume primarily in this area here, so we want to use more of the round implants to give her a nice rounder shape to her buttocks. In addition, not only are we going to do implants, but we're also going to do a lower buttock lift. Basically, she has some extra tissue in this area here, and with a lower buttock lift, we're going to lift this up kind of like this to give her a more round shape to her buttocks. We're going to try to make the incisions towards the middle as much as possible so they're not showing very much, but the lift helps bring this in this fashion here with the implant. Combining these two procedures, I think she's going to have a wonderful result. When we do buttock implant surgery, we always want to talk about the size. One of the things we have to do is to get the size of the hips. And hers is around 34. So we compare that to a chart. The chart will tell us approximately the size of the implant that we're able to put inside of her. And we use this chart routinely. In addition to the chart, however, we also want to measure a few other things. We want to measure from the middle to the sides, especially the trochanter. The trochanter is the top of the femur. We want to measure this area here to see about how much we can put, how big of an implant we can put. So we can put a nice implant in, not too big. Don't want it too big, you want it to fit. The implant fits the muscle. The muscle is the gluteus maximus muscle here. We want to outline where the muscle is located. So in order to do that, the way we do that is to start putting some guidelines in. First of all, we want the incision to be not too high. We like the incision to be below this line here in the crack, in the intergluteal fold. And the muscle tends to be attached in this area all the way down to her femur. The way we can identify that is we palpate the little nodule, the depression right here, which is the iliosacral joint, right in this area here. Right next to this is the spine, and the spine is approximately in this area right in here. You can palpate it nicely. It's usually a little bit below and to the side of that. So this will be our starting point right here. Here's the iliac crest, and it goes down to the spine. We then measure a line approximately 5 centimeters from the spine up. And we want to measure on the trochanter. The trochanter lies in this area here. And we're going to just outline the trochanter in this fashion here. So we combine this in this fashion like that. So the upper limit of the gluteus maximus muscle is way up here. The lower limit starts in the coccyx around here and goes through the tubercle, the ischial tuberosity right down here. And it actually combines onto the lateral surface of the femur in this direction here. So this is basically the border of the gluteus maximus muscle. We want to be able to dissect into this to fit the implant in this area here. And then at the same time, as I mentioned, we're going to lift this up. We're going to do the lower buttock lift in this area here, bringing this up. And so we can sort of see where our line is right now. We want to try to stay within the midline as much as possible. So we would like to try to make the incision in this area here. Lift the lower buttock, create a nice angle here, and the same on this side. try to lift this up like that. To insert the implants, we're going to make an incision in this middle area here, and we're going to put the implants approximately in this area here. So they're basically, essentially in the middle of the gluteus maximus muscle. We want to try to dissect this in such a way that the implants are a little bit on the higher side, so as they drop over time, it doesn't drop excessively, but it always stays within the muscle. The incision is here. We're going to dissect into here and go in between the muscle. The procedure is done intramuscular. In other words, we're going to separate the gluteus maximus muscle in the middle, and therefore the implant will be sandwiched within the muscle, with a layer of muscle on the outside and a layer of muscle on the inside. The dissection that we performed on the sides is underneath here. Now what we do is we measure approximately 7 centimeters to the side, and along the lines of the gluteus maximus muscle, we will be dissecting in this area here. We'll make an incision on the muscle approximately like this, inside on the muscle. What I have done is to mark a line here that is a very horizontal line. As the patient stands up, we sort of measure her to make sure this is correctly right and horizontal. And from there we can make sure that the distances from here to the lower area is the same from one side to the other side. We measure these, that way when we do this lift here, this will be the same here as in this side here. And this will be helpful for us during the operation too, because during the procedure things get a little distorted. So this way we can have our line here that will give us a very good frame of reference of where the horizontal is for her. We want to also make sure that the bottom part is very horizontal too. Hers are pretty equal, so we'll use this bottom part, the bottom one here, to fit. When we do the lower buttock lift, notice I have two lines here. One is up and down here, one is up and down, and one is kind of crossed over here. This will come to here, because we'll pull these in. And so you'll notice that this line will become even with this line as I pull this in like this. So by doing it that way, we bring the outside in and are able to make this line nice and straight and give her a nicer round shape.